Welcome back, everyone, for another deep dive. This time, we're going to be exploring something.
Exciting.
Yeah, we're going to be looking at the connection between physical health and mental well-being.
Okay.
And we've got this,
Interesting.
this academic text all about mood disorders.
Okay.
It goes way beyond just like the typical anxiety and depression that we
Right.
hear
Yeah.
about all the time.
Yeah. That's right. What we're looking at today is how certain medical conditions
Yeah?
can actually be the root cause of some mood disorders.
It's almost like our bodies are playing tricks on us,
Yeah.
making us think it's all in our heads,
Right.
when it actually might be something physical going on.
Yeah. Yeah.
And our source material here really uncovers some fascinating and honestly concerning stuff.
Absolutely.
Like, did you know that up to 1 in 10 cases of major depression
Wow.
could be traced back to a medical condition?
That statistic always makes me pause.
Yeah.
It's published back in '93 by Clinton, but it's just a stark reminder that we really need to consider the whole picture when it comes to mental health and not just assume that it's all in your head.
Right. So it's not just about feeling down because you're sick.
Right.
It's an actual mood disorder.
Yeah.
Just like depression or anxiety.
Yeah.
But it's triggered by a physical condition.
Exactly.
It's a DSM.
Oh,
This
yeah.
is, the official manual for diagnosing these things.
Yeah, the DSM is like the comprehensive guidebook that mental health professionals use to help them understand and diagnose
Yeah.
various mental health conditions.
It's a real deal. Diagnosable condition.
Absolutely.
So, but how do you even tell the difference?
Right.
What are the signs that a mood swing might be tied to a medical issue?
Well, that's where it gets a little tricky
Yeah.
because the symptoms can look a lot like typical depression,
Okay.
sadness, fatigue,
Mm.
loss of interest in things you normally enjoy.
So nothing out of the ordinary so far.
No, but here's where it gets really interesting. Sometimes these medical conditions can trigger the opposite. Mania?
Mania.
Yeah,
So-
we're talking
so-
extreme highs.
Pretty drastic mood swing.
Yeah, risky behavior, racing thoughts, the whole 9 yards.
Yeah.
It's like the flip side to the depression coin.
To come from, say, a thyroid issue,
Yeah,
it's hard to wrap my head around a physical condition
right.
causing such intense emotional shifts.
Absolutely. And you've hit on a key point there.
Yeah.
It's not always intuitive how a physical ailment can manifest as a mood disorder.
Yeah.
So take the thyroid, for example.
Okay.
Plays a huge role in regulating our metabolism,
Mm.
but also influences hormone production, which has
Right.
a cascade of effects on brain chemistry and neurotransmitters.
Yeah.
When your thyroid is out of whack,
Uh-huh.
it can throw those delicate balances off,
Yeah.
leading to mood swings like depression or anxiety.
So it's like a domino effect.
That's a great way to put it.
Yeah, one thing throws off another, and before you know it,
Yeah.
you're on this emotional roller coaster.
And to officially diagnose this kind of mood disorder, the DSM outlines 5 key criteria
Hey.
that need to be met.
Lay 'em on me.
First,
Mhm.
there has to be a noticeable change in your mood.
Okay.
It could be feeling down in the dumps,
Ah.
losing interest in your hobbies,
Right.
or even experiencing that intense high we talked about, mania.
Got it. So a definite shift from your usual emotional state.
Exactly.
Yeah.
Secondly,
Yeah.
those mood changes need to be directly linked to a diagnosed medical condition.
Okay.
So it's not just feeling down because you're stressed about work.
right.
There needs to be a clear physiological connection.
So like a doctor would have to confirm a diagnosis
Exactly.
that could explain those feelings.
Like putting the pieces of a puzzle together to
Yeah.
see a full picture.
Gotcha.
Then the
Right.
third point is that the mood swings can't be better explained by another mental health issue. It's about ruling out other possibilities.
Right. So you don't want to be treating the wrong thing.
Exactly.
Thanks.
The mood issues can't only happen during an episode of delirium.
Delirium.
Delirium can cause confusion, sudden change in mental state,
Yeah.
but this criteria means the mood problems have to persist outside of those periods.
So the mood issues need to be like a consistent pattern, not just a one-off event.
Exactly.
Okay.
And lastly, those symptoms have to significantly impact your daily life.
Oh,
We're not just talking about a minor mood swing.
right. It's got to be something that's really throwing a wrench in your everyday routine.
Exactly. It needs to be something that affects your ability to function at work,
Yeah.
at home, or in your relationships.
Makes sense.
So these criteria help ensure we're addressing a true medical concern
Right.
that's interfering with someone's well-being.
Okay. So we've got the criteria down.
Yeah.
Now, the source material actually lists 10 specific medical conditions
Yes.
that are often linked to these mood disorders.
Right.
Shall we dive into those?
Let's do it.
All right, so first up,
First up, Parkinson's disease.
Parkinson's disease.
Yeah.
Most people associate Parkinson's with tremors and movement difficulties.
Right.
But here's the surprising part.
Yeah.
Depression is incredibly common in people with Parkinson's.
It is, but the mental health aspect is often overlooked.
Really? I always thought of it as primarily a movement disorder. So someone could be treated for depression for a while.
And in fact, sometimes depression is the first sign of Parkinson's.
Wow.
Even before the tremors start.
Before anyone realizes it's actually a symptom of Parkinson's. That seems like it could lead to some serious delays
It can.
in getting the right treatment.
Yeah.
Why is depression so prevalent in Parkinson's patients?
That's a great question, and it's something researchers are still trying to fully understand.
Okay.
One theory is that the same neurological changes happening in the brain that cause the movement problems can also disrupt the brain circuits that regulate mood.
So it's like a double whammy,
It is.
affecting both movement and emotions.
Yeah.
Okay, what's the next condition on our list?
Next up is multiple sclerosis, or MS.
MS. Okay.
This is another condition where mood disorders are very common.
Okay.
MS affects the central nervous system,
Right.
and the damage it causes can interfere with the transmission of signals in the brain,
Yeah.
which can lead to all sorts of neurological symptoms, including mood swings.
So it's like MS is messing with the brain's communication system.
Exactly.
Okay.
And it's not just depression we see with OS.
Oh.
Euphoria,
Euphoria?
or feeling excessively happy,
Okay.
is also common.
Huh.
It might seem counterintuitive, but those high spirits can be just as disruptive as depression.
So it's almost like the brain's wiring is getting crossed, causing these unpredictable highs and lows.
Yeah. And it can lead to
Yeah.
impulsive or risky behavior.
That's fascinating and a little scary too.
Yeah.
Makes you wonder what else could be going on beneath the surface.
Right.
Okay, what else do we have on our list?
Let's talk about seizure disorders.
Okay.
This one's especially complex
Okay.
because the type of seizure someone experiences can actually influence the type of mood changes.
So different seizures, different moods.
Precisely.
Right.
For instance, temporal lobe seizures, which originate in the part of the brain responsible for memory and emotion, have been linked to mood disorders.
Okay.
On the other hand, complex partial seizures can actually trigger psychosis.
Hold on, psychosis.
Yeah.
For our listeners who may not be familiar,
Sure.
could you explain what that means?
Psychosis is a serious mental state where someone loses touch with reality.
Okay.
They might experience hallucinations, like seeing or hearing things that aren't there, or delusions, which are strongly held beliefs that are not based in reality.
Okay, so that sounds incredibly frightening. Yeah. It's disturbing to think that a seizure could trigger such a severe mental state.
And the impact of seizure disorders on mental health is significant.
Yeah.
In fact, a heartbreaking statistic, 30% of people with epilepsy have attempted suicide at some point in their lives.
That's a devastating statistic.
It is.
It just goes to show how critical it is to address the mental health needs
Absolutely.
of people with seizure disorders.
For sure.
And make sure they have access to
the
resources and support they need.
Absolutely.
Okay, what's the next condition we need to unpack?
Let's move on to a condition that you might not immediately think of when it comes to mood. Diabetes.
Diabetes. I don't.
Yeah.
That's all about blood sugar, right?
It is, but
I don't see the connection to mood.
it's actually a two-way street.
Okay.
Depression can increase your risk of developing type 2 diabetes. And on the flip side, having diabetes doubles your risk of experiencing depression.
So it's like a vicious cycle.
Exactly, and it makes sense when you think about it.
Yeah.
Living with a chronic condition like diabetes, managing your blood sugar, making lifestyle changes, it can be incredibly stressful and take a toll on your mental health.
Right. If you're feeling down and unmotivated,
Exactly.
you're less likely to stick to a healthy diet, exercise regularly, or monitor your blood sugar diligently.
Exactly. And that's why addressing the depression is so important.
Yeah.
It's not just about improving mood, it's about improving overall health outcomes.
This is all reminding me how connected our bodies truly are.
AR.
How everything seems to impact everything else.
Absolutely.
Okay, what's next on our list of conditions?
This one is less common, but quite fascinating.
Okay.
Parathyroid disorder.
Parathyroid disorder. I've got to admit, I'm not familiar with that one.
The parathyroid glands are these tiny rice-sized glands located in your neck.
Uh-huh.
They play a crucial role in regulating calcium levels in your body.
Calcium. So we're talking about strong bones and teeth.
Right.
How does that relate to mood?
Well, here's the fascinating part. Both having too much and too little parathyroid hormone.
Whoa, really?
Can cause mood problems.
Both ends of the spectrum. That's wild.
Yeah.
So we're talking about two different disorders here, right?
Exactly.
One where the glands are producing too much hormone, and one where they don't produce enough.
When the parathyroid glands produce too much parathyroid hormone, it's called hyperparathyroidism.
Hyperparathyroidism.
And when they don't produce enough, it's called hypoparathyroidism.
Hypoparathyroidism. All right, I'm following so far.
Oh.
But how do these imbalances affect our mood?
Well,
what's the connection there?
That's where things get really interesting.
Okay.
Calcium plays a vital role in various bodily functions, including nerve transmission and muscle contraction.
Okay.
When calcium levels are off due to either too much or too little parathyroid hormone, it can disrupt those delicate processes, leading to a whole cascade of symptoms.
Okay, I'm starting to see the connection.
Okay.
But what kind of mood problems are we talking about here?
The range is pretty broad.
Okay.
On the one hand, people with parathyroid disorders might experience depression, anxiety, irritability.
Right.
But on the more extreme end,
they
can even experience delirium. Or even slip into a coma.
Wow. That's serious stuff.
Yeah.
So these tiny glands in our neck can have a huge impact on our mental state.
It really highlights the interconnectedness of our bodies. And how even seemingly small imbalances can have major consequences.
It's incredible.
It reminds us that we can't separate physical health from mental health.
This is blowing my mind a little bit.
Yeah.
Okay. What's the next condition on our list?
Let's move on to thyroid disorders.
Okay.
You're probably familiar with the thyroid gland.
I am.
It's located in your neck.
Right.
Plays a crucial role in regulating your metabolism.
Right. I know people talk about having an overactive thyroid or an underactive thyroid.
Right.
But how does that affect your mood?
You might be surprised to hear this.
Okay.
But both an overactive thyroid, hyperthyroidism, and an underactive thyroid, hypothyroidism, can cause both depression and anxiety.
Whoa, so no matter which way the thyroid swings.
That's right.
It can mess with your mood.
It's like Goldilocks. The thyroid needs to be just right for optimal mental health.
Wow.
When the thyroid produces too much thyroid hormone, hyperthyroidism, it can rev up your metabolism, leading to symptoms like a racing heart, weight loss, difficulty sleeping.
Gotcha.
All of that can contribute to anxiety and even lead to panic attacks.
So it's like your body's in overdrive and your mind can't keep up.
Exactly. And on the other hand, when the thyroid isn't producing enough thyroid hormone, hypothyroidism, it slows down your metabolism, leading to fatigue, weight gain, difficulty concentrating.
Gotcha.
These symptoms can make you feel sluggish, withdrawn, and even depressed.
So it's like your body is running on low power? And your mind feels drained as well?
That's a great way to put it. And what's really interesting is that in severe cases of hypothyroidism, there's a term for the type of psychosis that can occur. Myxedema madness.
Myxedema madness.
Yeah.
That's a term I'm not going to forget anytime soon.
Right.
So can you break that down for me?
Think of it as a severe form of mental and physical deterioration. It's relatively rare these days. But it can involve hallucinations, paranoia, and even coma.
Wow.
It really underscores the importance of getting your thyroid checked. If you're experiencing any of these symptoms. Especially if you have other signs of a thyroid disorder.
It's another reminder that those tiny glands in our neck play a surprisingly big role in our overall well-being. Absolutely. All right, and speaking of systems that play a big role in our well-being. Let's move on to heart disease.
Heart disease.
Yeah, you might not immediately think of heart disease and mental health as being connected. But as we've seen with other conditions, it's another two-way street.
Exactly.
I mean, like with diabetes, where depression can increase the risk of heart disease, And having heart disease can increase the risk of depression.
Exactly. And this connection is especially concerning because studies have shown that people who are depressed after a heart attack
Oh, wow.
actually have a higher risk of dying
Than those who aren't depressed.
than those who aren't.
Whoa.
Yeah.
So it's not just about quality of life here.
Right.
It's about survival.
Yeah.
But why is depression so dangerous in the context of heart disease?
Right.
What's the link there?
It's a complex interplay of factors.
Okay.
Depression can lead to unhealthy behaviors like poor diet, lack of exercise, and smoking, which can further damage the heart.
Right. If you're struggling with depression, it's harder to find the motivation to take care of yourself.
Exactly.
Yeah.
And on a physiological level,
Okay.
depression can cause changes in the body's stress response system, leading to inflammation and increased blood pressure.
Okay.
All of these factors can put additional strain on the heart.
So it's like a perfect storm of negative effects.
Right.
Depression weakens the body, makes it harder to make healthy choices, puts extra stress on the already weakened heart.
That's a great way to summarize it.
Yeah.
Addressing depression in heart disease patients is absolutely crucial.
Wow.
It's not just about improving mood. It's about improving their chances of survival.
This is another example of why we can't treat mental and physical health as separate entities. They're inextricably linked.
They are.
Okay. What's the next condition on our list?
Let's talk about HIV/AIDS.
HIV/AIDS, okay.
You might think that depression in people with HIV is just a natural reaction to the diagnosis.
Yeah, but it's more than that, right?
You got it.
It's an actual mood disorder that deserves attention and treatment.
Up to 1 in 3 people with HIV experience depression.
Wow.
But it's often missed or misdiagnosed.
Why do you think that is?
Well, there's still a lot of stigma surrounding HIV.
Right.
And that can make it difficult for people to talk openly about their mental health struggles.
Yeah.
Additionally, healthcare providers might assume that depression is just a normal reaction to this stress and fear.
Right. So it's like their emotional distress is being dismissed.
Exactly.
As understandable, when it might actually be a treatable mood disorder.
And that's a real problem.
Yeah.
Untreated depression can lead to isolation, poor adherence to HIV medication, and even suicidal thoughts.
That's scary.
It's crucial that we recognize depression in people with HIV as a serious medical condition.
Right. It's about seeing the whole person, not just the disease. Okay. What's the next condition on our list?
Let's talk about cancer.
Cancer. Yeah.
It's no surprise that a cancer diagnosis is emotionally devastating.
Yeah, I can't even imagine.
The fear, the uncertainty, the treatments.
The emotional roller coaster.
It can all take a toll on mental health.
That people with cancer go through.
It's incredibly challenging.
Yeah.
And statistics show that about 25% of cancer patients experience depression.
25%. That's a huge number.
It is.
What are some of the reasons why depression is so prevalent in cancer patients?
It's a combination of factors.
Okay.
First, there's the psychological impact of the diagnosis itself.
Right.
Facing your own mortality.
Yeah.
Dealing with the side effects of treatment.
Yeah.
Coping with the changes cancer brings to your life.
Right.
It can be incredibly overwhelming.
Yeah.
And then there are the physical factors.
Yeah.
Cancer itself can release substances that affect brain chemistry, and some cancer treatments can directly cause depression as a side effect.
So it's a combination of emotional stress, physical changes, and sometimes even the treatments themselves.
Exactly.
Wow.
And unfortunately, despite how common depression is in cancer patients, only a very small percentage actually receive antidepressants.
Wait, only a small percentage. Why is that?
There are a few reasons.
Okay.
Some doctors might dismiss depression as a natural reaction to cancer.
Okay.
And not consider it a separate medical condition that needs treatment.
Right.
Others might worry that antidepressants will interfere with cancer treatment.
Right.
And then there's the stigma surrounding mental health.
Yeah.
Which can prevent people from seeking help.
But that's not necessarily true, right?
Yeah, right.
Antidepressants can actually be helpful.
In many cases, treating depression can actually improve a person's ability to cope with cancer treatment.
Wow.
It can boost their energy, reduce fatigue, and help them focus on their recovery.
So it's not just about improving mood.
Right.
It's about giving them the strength and resilience they need to fight the disease.
Exactly. And it's important to remember that treating depression in cancer patients isn't just about medication.
Right.
It's about taking a holistic approach that involves therapy, support groups, and other strategies to address their emotional needs.
This all highlights the importance of integrated care.
Absolutely.
Making sure that mental health is addressed alongside physical health.
And that brings us to our last condition for today, stroke.
Stroke, okay.
You might think of a stroke as primarily a physical event.
Right.
But it can have significant consequences for mental health as well.
That makes sense. A stroke affects the brain,
Right.
and the brain controls everything,
Exactly.
including our emotions.
Studies have shown that depression rates are significant after a stroke.
Okay.
About 27% of stroke survivors experience major depression.
Wow, those are big numbers.
And another 40% have some symptoms of depression.
What causes depression after a stroke?
Right.
Is it the damage to the brain?
That's a big part of it.
Okay.
The area of the brain damaged by the stroke can play a role.
Okay.
If the stroke affects areas involved in regulating mood, it can disrupt those circuits and lead to depression.
Gotcha.
But it's not just the physical damage.
Right.
The emotional impact of a stroke can be devastating as well.
It's a life-changing event.
Exactly. Suddenly you might be dealing with physical disabilities, cognitive impairments, difficulty communicating.
Right.
It can all contribute to feelings of sadness, hopelessness, anxiety.
And I imagine that depression can make it even harder to recover from a stroke.
You're absolutely right.
Yeah.
Depression can sap your motivation,
Right.
make it difficult to participate in therapy, and hinder your overall recovery.
So it's like a vicious cycle.
Precisely.
The stroke can cause depression, and the depression can make it harder to recover from the stroke.
And it's not just about the physical recovery.
Right.
Depression after a stroke can lead to social isolation, strained relationships, and a decreased quality of life overall.
So it really touches every aspect of a person's life.
It does, and that's why it's crucial to address depression after a stroke,
Right.
just as we would address any other complication.
Okay.
Treatment might involve medication, therapy, support groups, or a combination of approaches.
Yeah.
The goal is to help the person regain their emotional well-being and support their overall recovery.
This all goes back to the importance of recognizing the mind-body connection.
Absolutely.
And treating the whole person.
And it's important to remember that we've only scratched the surface here.
Right. This isn't an exhaustive list.
Exactly. We've covered 10 medical conditions that can commonly cause mood disorders, but there are many others out there.
Yeah.
The key takeaway here is that physical health and mental health are intertwined.
They are.
If you're experiencing mood changes, especially if you have a diagnosed medical condition, it's crucial to talk to your doctor. Don't brush it off as just part of being sick or just stress.
Sometimes it's deeper than that.
You got it.
Yeah.
It's always better to err on the side of caution and get checked out.
Right.
You deserve to feel your best, both physically and mentally.
Well said. Okay. So we've covered a lot of ground here. 10 medical conditions that can impact mood.
We have.
And we've really highlighted the importance of recognizing the connection between our physical and mental health.
Absolutely.
It's like we've pulled back the curtain and peeked inside the intricate workings of the mind-body connection.
I like that analogy. And it reminds us that even though we've come a long way in our understanding, there's still so much more to discover.
This is just the tip of the iceberg.
It is.
Okay, so should we
take a break?
Yeah, should we take a quick break and then come back and talk about treatment options?
Sounds good to me. Let's give our listeners a moment to process all this information.
Yeah. Awesome.
It's pretty remarkable how often this connection is overlooked.
Yeah, it's like we're trained to compartmentalize our health. Physical problem, go to the doctor.
Right.
Emotional problem, talk to a therapist.
Right.
But what we've been unpacking today really shows just how artificial that separation is.
I completely agree.
Yeah.
It's all connected.
Yeah.
And that's where things get really interesting when it comes to treatment.
Okay.
It's not just about popping a pill or having a therapy session. It's about understanding the whole picture and finding the right combination of approaches to address both the physical and the mental aspects.
So walk me through that.
Okay.
What does treatment for a mood disorder caused by a medical condition actually look like?
Well, the first and most important step is addressing the underlying medical issue.
Okay.
If we can get the physical condition under control, it often has a positive ripple effect on mood.
So it's like tackling the root of the problem rather than just pruning the leaves.
But it's often not that simple.
Okay.
In many cases, even after the medical condition is stabilized, people might still need additional support to manage their mood.
So what other tools are in the toolbox, so to speak?
Well, on the psychiatric side,
Okay.
medication can be really helpful for stabilizing mood.
Okay.
Antidepressants, for example, can help boosts levels of certain neurotransmitters in the brain that regulate mood, like serotonin and dopamine.
So it's about giving the brain a little chemical boost.
You could think of it that way.
Yeah.
And in cases where someone is experiencing mania,
Right.
mood stabilizers might be prescribed
Okay.
to help even out those extreme highs and lows.
So it's about finding the right medication to address the specific mood symptoms someone's experiencing.
Exactly.
But what about the psychological side?
Right.
What role does therapy play in all of this?
Therapy is crucial.
Okay.
It provides a safe and supportive space for people to process their emotions,
Right.
learn coping skills, and develop strategies for managing their condition.
So it's not just about talking about your feelings.
Right.
It's about equipping people with practical tools to navigate those feelings.
Therapy can help people understand the connection between their physical health and their mood.
Right.
And it can empower them to take an active role in their recovery.
It's about giving them a sense of control.
You've hit the nail on the head.
Yeah.
And there are so many different types of therapy that can be helpful in these situations.
Yeah.
Cognitive behavioral therapy, for example,
I've heard of that one.
can help people identify and challenge negative thought patterns.
Right. It's about retraining your brain to think more positively.
Exactly.
Yeah.
And then there's mindfulness-based therapy,
Okay.
which teaches people how to pay attention to the present moment without judgment.
Okay.
This can be really helpful for managing stress and anxiety
Right.
and for developing a greater sense of self-awareness.
So many options. It seems like finding the right type of therapy is just as important as finding the right medication.
I couldn't agree more.
It's about tailoring the approach
Exactly.
to the individual.
There's no one-size-fits-all solution. When it comes to treating mood disorders caused by medical conditions,
Makes sense.
it requires a collaborative approach
Yeah.
with open communication between the person, their doctor, their therapist,
Right.
and any other healthcare professionals involved in their care.
It's like a team effort
Exactly.
with everyone working together
Mm-hmm.
to create a personalized treatment plan.
And it's important to remember that finding the right treatment can sometimes be a journey.
Right. It's not always a quick fix.
Exactly.
It's about being patient, persistent, and advocating for yourself
I love it.
until you find what works.
And speaking of advocating for yourself, we need to talk about something really important. Stigma.
Stigma. Yeah.
Sadly, there's still a lot of stigma surrounding mental health.
It's like this unspoken shame that surrounds mental health issues.
Right.
People might worry about being judged or labeled as crazy
That's
if they
right.
admit to struggling.
And that stigma can be even stronger
Yeah.
when the mood disorder is linked to a physical condition.
Right. Like they should just be able to suck it up.
Exactly.
Or that their mood changes are just a normal part of being sick.
Precisely.
Yeah.
And that couldn't be further from the truth.
Yeah.
It's crucial to remember that mood disorders are real medical conditions.
Yes.
Regardless of what caused them.
Right.
They deserve attention and treatment, just like any other health issue.
It's about normalizing mental health care.
Absolutely.
Breaking down those barriers of shame and silence.
And that starts with education.
For sure.
The more we talk about the connection between physical health and mental health,
Yeah.
the more we can destigmatize mental health issues
Right.
and empower people to seek help.
Knowledge is power.
Yeah, absolutely.
Okay, so we've talked about the importance of addressing the underlying medical condition. We've explored the roles of medication and therapy.
Right.
We've addressed the elephant in the room, stigma.
Yeah.
Is there anything else we need to cover in terms of treatment?
One thing I want to emphasize is the importance of integrated care.
Integrated care. Yeah.
This means that mental health care is seamlessly integrated into all aspects of health care.
So it's not just about seeing a psychiatrist or therapist in isolation.
Right.
It's about having mental health be a routine part of your overall healthcare experience.
Exactly. Imagine a world where your primary care doctor routinely asks about your mood,
Right.
where your cardiologist understands the impact of depression on heart health,
Yeah.
where your oncologist is prepared to address the emotional challenges of cancer treatment.
That sounds like a much more holistic and compassionate approach
It is.
to healthcare.
And it's something we need to continue to push for.
Yeah.
We need to educate healthcare providers about the importance of mental health.
Right.
And we need to create systems that support integrated care.
It's about seeing the whole person, not just the disease or the symptoms.
Absolutely.
Okay, so we've covered a lot of ground on treatment.
Yeah.
What stands out to you as the most important takeaway for our listeners? What do you really want them to remember?
What I really want to drive home is that Mood changes are not something you have to suffer through in silence.
Right.
If you're experiencing significant mood swings,
Yeah.
especially if you have a diagnosed medical condition,
Right.
reach out for help.
Don't let fear or shame keep you from getting the support you deserve.
Exactly. And remember, treatment is not a one-size-fits-all approach.
Yeah.
It might take some time to find the right combination of medication, therapy, and lifestyle changes that work for you.
Right. It's your health, your journey, your right to feel your best.
I love that.
That's such an empowering message.
It is.
We're not powerless in the face of these challenges.
Mm-hmm.
There are things we can do to manage our mood and improve our quality of life.
Absolutely. And remember, seeking help is a sign of strength, not weakness.
Right.
It takes courage to acknowledge that you're struggling.
Yeah.
And to reach out for support.
Well said. Okay, before we wrap up this deep dive, can we take a moment to revisit that fascinating question you posed earlier?
Oh, I'm so glad you brought that up.
The one about with the connection between seemingly unrelated conditions,
Yeah.
like parathyroid disorders and mood, tells us about the mind-body connection.
That's a question that's been swirling in my mind throughout our conversation. It really speaks to the complexity of the human body and how interconnected everything truly is.
Right. It's like those tiny parathyroid glands are sending ripples
Yeah.
throughout the entire system,
Yeah.
affecting things we wouldn't even think were connected.
Right.
What are your thoughts on this?
What fascinates me is that it challenges our traditional ways of thinking about health.
Okay.
We're so accustomed to compartmentalizing the body, heart, lungs, brain, hormones. But in reality, it's all one integrated system.
It's like we're trying to understand a symphony by only listening to one instrument at a time.
Exactly. And I think this understanding has profound implications for how we approach healthcare.
Right.
It's not enough to just treat the symptoms or focus on one isolated part of the body.
Yeah.
We need to consider the whole person, their physical health, their mental health, their social environment, their lifestyle. It's all part of the equation.
It's about embracing a more holistic and integrated approach
Precisely.
to healthcare.
And I think this understanding of the mind-body connection
Yeah.
empowers us to take a more proactive role in our own health.
Right.
It reminds us that our thoughts, emotions, and behaviors can have a direct impact on our physical well-being.
So it's not just about what we put into our bodies. It's about how we manage stress, cultivate positive emotion, engage in activities that nourish our minds and spirits.
Exactly. It's about taking a holistic approach to self-care.
Right.
And recognizing that our mental and emotional well-being are just as important as our physical health.
This has been such an enlightening conversation.
It has.
It's made me realize just how much I still have to learn about the intricate workings of the human body.
It is amazing.
And the powerful connection between the mind and body.
I feel the same way.
Yeah.
It's a constant journey of discovery.
Okay, I think it's time to wrap up this deep dive.
Okay.
But before we say goodbye, is there one final thought you'd like to leave our listeners with? Something to ponder as they continue on their own health journeys?
I think the most important message is this. You are not alone.
Yeah.
If you're struggling with mood changes, know that there are resources available.
Right.
There are people who understand, and there is hope for healing.
Beautifully said. And remember, knowledge is power.
Absolutely.
The more we understand about the mind-body connection, the better equipped we are to advocate for our own health and well-being.
Absolutely. And don't be afraid to ask questions.
Yeah.
Challenge assumptions.
Right.
And explore different approaches until you find what works for you.
It's your health, your journey, your right to feel your best.
That's right.
Until next time, fellow deep divers, keep those brains engaged and those bodies healthy.
Thanks for joining us.
We'll see you in the next deep dive.
Yeah, it's pretty incredible to think about all the things that affect our well-being, you know? It's almost like we're conductors of our own internal orchestra, just trying to keep all the instruments in harmony.
I love that metaphor.
Yeah.
And it reminds us that even small adjustments can have a ripple effect throughout the entire system.
So it's not about achieving some perfect state of balance,
Right.
but rather about being attuned to the subtle shifts and making those conscious choices to support our well-being.
Exactly. It's about developing a sense of self-awareness and learning what nourishes us.
Right. Both physically and emotionally.
This has been such an eye-opening deep dive for me.
I'm so glad to hear that.
Yeah, it's really shifted my perspective on the mind-body connection.
And I hope our listeners feel empowered to take an active role in their own health journey.
Absolutely. Knowledge is power.
It is.
Understanding how our physical health can impact our mood. Gives us a whole new set of tools to advocate for ourselves.
Well said. And remember, there's no shame in seeking help.
Right.
It's a sign of strength and self-awareness.
Couldn't agree more. Okay, so I think it's time to wrap up this deep dive.
Okay.
But before we say goodbye, is there anything else you'd like to share with our listeners?
Just this. I encourage everyone to keep exploring this topic.
Right.
The mind-body connection is a fascinating and ever-evolving field of study.
It is.
The more we learn, the better equipped we'll be to care for ourselves and those we love.
Wonderful. And I would add, don't be afraid to challenge conventional wisdom.
Right.
Ask questions. Be curious. Stay informed. Your health is worth it.
Absolutely.
Until next time, fellow deep divers, keep those brains engaged and those bodies healthy.
Thanks for joining us.
We'll see you in the next deep dive.